Karnataka is all set to become COVID state number 1 in the country. A very, very dubious distinction because while Maharashtra appears to be recovering from the COVID surge, Karnataka is emerging as the new COVID central with daily cases shooting up sharply. While Karnataka has the highest caseload, the doubling time in the state has also witnessed a very steep fall. The daily positivity ratio in Karnataka has tripled in less than a month. Take a look at why Karnataka is the new COVID Nataka.
A tale of two states. One which was the COVID epicenter and one which could become the next. The state of Karnataka is rapidly scaling the heights of COVID infections, closing in on Maharashtra in the daily tally. With the monster COVID surge, the doubling time of cases in Karnataka has alarmingly reduced from 84 days on April 15th to less than 30 days on May 12th. In the same duration, the doubling time in Maharashtra, on the other hand, has increased from 40 days to 68 days. Karnataka even surpassed Maharashtra in daily cases on Monday. Another harrowingly stat is that of the fatalities in Karnataka, which are growing exponentially. Fortunately, deaths have not seen a surge of the same magnitude in Maharashtra. The pace of vaccination has slowed down in the southern state. What's more worrying is that testing has also decreased substantially in recent days. But despite the declining testing rate, the daily positivity ratio in Karnataka has tripled in less than a month. It was 11.4% on April 15th and rose to 34% on May 11th. On the other hand, daily positivity ratio in Maharashtra is declining. It fell from 26.3% to 18.8% in the same duration.
Now, the second COVID wave has left Karnataka's health infrastructure in a precarious state. The active caseload is also the second highest in the country with close to 6 lakh cases. So unless the authorities come out with concrete measures to control this surge, we will surely become the epicenter of COVID-19 in India. With video journalist Madhuar, Nolan Pinto for India Today.
Now here's a quick breakdown of why Karnataka is facing this crisis. Why are the cases so abnormally high? And why is Karnataka all set to become the number 1 COVID state in the country? Number 1, there are invisible COVID spreaders. 10 to 15% of positive patients in the state, amazingly, are untraceable according to the government. Point number 2, it's a semi-lockdown that's in place in Karnataka, which means people are still gathering around markets and spreading the virus. Number 3, there is a delay in RT-PCR test results. So asymptomatic people are moving around and posing a threat to the spread. Number 4, there's negligible tracing of primary and secondary contacts taking place any longer in Karnataka. And there is no checking at airports in states or in any of the districts. So those are the 5 main reasons why things are so bad. And here are the factors that are adding to Karnataka's COVID problems. This is the manifestation, the symptoms. No ICU beds available for citizens. Very negligible oxygen beds. It's hugely difficult to get an oxygen bed. Remdesivir and other drug distribution is in a mess. There is a delay in supply inside the state. And of course, there is a major vaccine shortage. Vaccine supply is practically stopped in the state, and healthcare workers are completely fatigued. But amidst this massive vaccine shortage, the Karnataka government has now announced that it will be temporarily stopping vaccination for those aged between 18 and 44 from tomorrow. The Yediyurappa government says that this has been done to prioritize vaccination of those above the age of 45 who are due for their second dose. Vaccination drive will be temporarily suspended for that age group, including those who've already booked appointments. So you can just imagine the reactions on the ground.
The news about the youth vaccine drive getting cancelled or postponed is just devastating. I mean, it's just one thing after another with this government. First, there's no oxygen, then there is no beds. The entire healthcare system has crumbled in this state. And there's just no one is being held accountable. No one takes responsibility. The blame is being shifted from one person to another. People are literally fighting for their lives, and it's shocking to see that the government doesn't see it the way it is. It almost feels like they're delusional in a sense.
Karnataka Deputy Chief Minister Ashwath Narayan, meanwhile, spoke to India Today's Rajdeep Sardesai just a few minutes ago on the vaccine shortage in this state. Listen in.
You have only vaccinated about 2% of your population when it comes to double dose. Clearly, there's a question mark. Do you have enough vaccines at the moment?
Sir, above 45, we are now vaccinating each day. We are providing 1 lakh doses, sir. Above 45. Below 45, between 18 to 44, we are providing every day 30,000 doses of vaccine. 30,000. So we had a stock of nearly 7 lakhs, and in that we have spent already around 1 lakh vaccines. Remaining 6 lakh was in store, and we were assured a supply of around 15 lakh doses we were assured, and we had no problem. Only thing is how many doses are we going to give each day was the question. So we started with 30,000. Gradually we want to scale up and ensure as and when the numbers can be increased depending on the commitment by the supplier, how much is going to supply. Based on that commitment, we want to escalate it. And there is no question of shortage, sir. Probably the numbers are small, but the demand is more.